Spine surgery demands strength, not just from patients, but from surgeons as well. Scientific Session 6, Inspiration to Climb, explores the physical and emotional realities of spine surgery and the resilience required to meet them. This session takes an honest look at the demands of the profession, the weight of complex decision-making, and the importance of caring for ourselves as we care for others. Through focused conversation on surgeon resilience and a dedicated panel discussion, we reflect on shared challenges and collective strength. This is a moment to pause, reflect, and recommit, strengthening our community as we continue elevating the quality of spine care at the Spine Summit.
Please welcome our first speaker, Dr. Kelley Banagan, to the stage.
Thank you all for having me. I'm really honored and privileged to be here. And more specifically, I just want to let you know that the next 10 minutes of my life, I've spent more time preparing than my husband or children would ever care to admit that I've taken away from them. It's really hard to get up in front of a group of highly intellectual people and talk about something that maybe we don't want to talk about or hear about. So thank you for this opportunity and inviting me to be part of your discussion. The objective of the next 10 minutes is to create a narrative about the unique physical and emotional demands of our profession, the consequences of those demands, how well we are or aren't doing, and what we can change. Surgeons too often are neglectful of our own health, despite the fact that we know that it's linked with the length of career with work and related stress. This is a public service announcement to all of you. If you think this is not pertinent, you are wrong. The stats would suggest otherwise. A half to a third of us have heavy, overwhelming workload and physical stress, and 50% of the people in this room over 50 have at least one major medical problem. The specific demands of our job are unique. We're exposed to high levels of radiation, smoke inhalation, postural demands, prolonged downward gaze, and emotional and mental demands from complex patient care. I first want to focus on the physical demands of our job, and then we'll transition to the harder topic, the emotional demands. Occupational exposures are no stranger to any of you all. Smoke levels from cautery, I was surprised to learn, exceed those of secondhand smoke. Radiation, sure, no doubt. Orthopedic female spine surgeons, increased risk of breast cancer. SRS members, 25% higher risk of thyroid cancer. And despite this, we still don't protect ourselves. So what are we doing? Well, the obvious, right? We're limiting the exposure from our eyes and our hands. We're distancing ourselves from the serum. And now let's talk about where the trends are taking us. Navigation, sure, great. We can fight it, but it's coming and it's standard of care. And maybe it's helping us develop less cancer, so there's that. Now let's talk about ergonomics. These are two great articles that I would encourage everyone to read. I certainly was never taught this, and I certainly haven't taught it to my fellows and residents. So what are we doing in the operating room? Well, we're standing for a long time, especially those of us who do any deformity surgery. Then we do the same thing over and over again in a forceful way. And then we put in all these instruments. 15 years ago, SRS conducted a surgery. I'm going to repeat that again. 15 years ago. And what did we find? Oh, great news. All of us are developing cervical radiculopathy, lumbar radiculopathy, lateral epicondylitis, rotator cuff pathology, varicose veins, and edema in our legs. And why is that? Because we stand for too long. We put ourselves in these awkward positions, and we hold our necks in a forward flex posture. So in brief, spine surgery is kyphosing to the surgeon. Look around the room. Look at your pillars. I hate to break it to you, but sometimes we're more kyphotic than the patient. 30 degrees of neck flexion results in 4 times the increased weight of the cervical spine, and 60 degrees of neck flexion and a head weight of 60 pounds. Loops and hand labs make this worse. And guess what? 40% of the time we're slouching during surgery. Risk factors for the badness, the total number of cases for neck pain and lower extremity edema, and spine deformity surgeons, it's your caseload for hand and wrist pathology. So what can we modify? You guys all know this, but obviously it bears repeating. Micro breaks, a microscope, adjust the table height to the height of the surgeon, not your assistant. Power tools and drills, lightweight lead, compressive socks and stockings, and most importantly, ergonomic training and exercise. Good news, if you've already glossed over, those of you who don't care about this, you probably can't hear me. And why is that? Because we're going deaf. As it turns out, the synergistic effects of continuous and impact noise put spine surgeons at risk of occupational noise-induced hearing loss. And it's not the long cases. In fact, it's even the short ones. And so what I would tell you is that this is not music in the room, this is not ambient noise, this is suction tubing and potentially drills. Now let's talk about all the other badness. So now we know we have cancer, epicondylitis, we can't hear each other, and then let's bring on stress and what that does to us physiologically. Well, here's the data. This is a brilliant study and so well conducted and so well done. This is a 40-year-old surgeon out of Australia who looked at himself over 100 cases. He's been in practice for 12 years, so he's not a newbie. What he looked at was average heart rate, maximum heart rate, energy consumption, room temperature, and his body weight. Heart rate was chosen as the parameter most to correlate with mental stress. As a reference for stress while operating, he compared himself to what he did working out. Here's what he found. He graded his cases per his data as medium difficulty, easy for him, and difficult. His average heart rate during an easy surgery was that of about walking at about 3 miles per hour. I don't walk anywhere at 3 miles per hour, so that was impressive to me. When he's doing a hard case, he's doing CrossFit. And lastly, the most important thing that I learned from this article and has really tried to change my perspective during surgery, he defined a critical cutoff of 2% body water loss. So he measured him, he got on a scale before and after his surgeries. He defined 2% body water loss as moderate dehydration. Does anyone know what happens when you're moderately dehydrated? You lose concentration and physical performance. So here we go. What's happening to our hearts? Length of surgery and intraoperative stress. What's happening when we stand for a long amount of time and then we don't drink water? We become dehydrated. Dehydration correlates with worsening cognition, visual, and motor skills. I would argue everyone in the room would tenant those three things as being inherent to performing good spine surgery. So what should we be doing? Things that I certainly am not doing. I don't know if you all are doing. Scheduled rehydration breaks. I've never done that. Stage surgeries. Okay, sure. But we just listen to talk upon talk about where we should perform a PSO and iliac fixation and endoscopic spine surgery amongst all these brilliant people. We stand up here and talk about bravado and what we're doing, but are we really changing what we're doing? Now let's hit it. For those of you who think that you hear the word burnout and you burn out, I'm going to beg for your attention for just a few more minutes. The unseen damage a stressful career in spine surgery can cause should not be overlooked. And this is why you should care. The burnout rate amongst orthopedic surgeons, trauma surgeons, and neurosurgeons, those of us across the world that perform spine surgery, has been described as exceptionally high. 30% among spine surgeons worldwide. All medical professions are at increased risk of suicide, and that prevalence is increasing. Sit with me and pause for a moment on that sentence. The suicide rate amongst U.S. surgeons is higher than the general population, including those with mental health disorders. And here you have it, a staggering fact. Amongst you wonderful neurosurgeons who graciously invited me to be here, I thank you. Maybe this isn't pertinent to you, but you know who it is pertinent to? Your colleagues, your partners, the people you're training. We, orthopedic surgeons, are killing ourselves at the highest rate amongst any medical professions. This is the best and brightest in the med school classes. This is the ortho bros. Now, granted, I don't look like one, but I can tell you I've shared a lot of space with them for the past 15 years. And what are we doing? Why is this happening? We're going to talk about resilience, and I'm not trying to steal anyone's thunder. In fact, the data would suggest that, and I certainly don't want to debate with you, and I don't want to be called a Muppet. So I'm going to just say that supposedly we have the resilience. Our mean score is higher than the general population. If that's the case, then why is our job literally killing us? And let's talk about it. Suicide, that's different from our normal vices. That's different from alcohol, drugs, those of us that have a predisposition to alimony, gambling. This is actually taking your own life. This is the reason I think that this is a problem. The stigmatism of needing help and our guidance is an issue for us. Of the 6.3% of spine surgeons that were brave enough to answer the questionnaire, only 26% sought psychiatric care for when they thought about killing themselves. That means that people in this room, people in your communities, people in your societies have thought about killing themselves, and they didn't get help. I think this is where the dialogue needs to go. I don't think this is about the advent of AI or the burden of our medical documentation or differences in training or generational gaps. I think this is because we don't take the time and energy to have the difficult conversations when they need to happen. These are two other brilliant articles that look at traumatic stress among surgeons. What has never been studied in a wonderful and meaningful way is how this pertains to spine surgeons and orthopedic surgeons. I think this happens in training. I think this happens in medical school. I think this happens with junior attendings. I think this happens with senior attendings. Why do we have protocols for everything in medicine and spine surgery and no protocol that exists for your first neurologic injury, your first death, your first malpractice lawsuit, your first confrontation with a colleague, You're first beat down by administration. We never have the conversations, and so they go left untouched. And so what I know and what I've learned, I've been burned out, and I've made really poor choices regarding health both in and out of the OR. The picture of me falling asleep on my bed is in training wearing the famous pink shock trauma scrubs. I used to consider those a badge of honor. I still have the scrubs. Is that really worth it? And the picture of me on the right is 9 months pregnant after I fell down the stairs while taking level 1 trauma call and had a Liz Frank injury. For the orthopedic people in the group, that's a devastating injury that required operative intervention. I still went back to the OR despite the advice of my surgeon, non-weight bearing, and it was only thanks to the help of my 2 fellows and wonderful scrub assistants that I got through those cases. I used to tout this as how strong I was. I now tout this as how stupid I was. I put myself at risk, I put my daughter at risk, and I put the patient at risk, and I don't think it made me stronger. In the words of my mentor and former partner, Dan Gelb, some days the spine wins. So here's the summit at the summit. We all know that sometimes the green trail can become the black. And if we don't help ourselves and we don't change this dialogue, every day the spine is going to win. So what should we do? This is what I would argue. This is what I challenge you with. We should educate ourselves. We should discuss this amongst ourselves. We should evolve. We should collaborate. We should understand what's going on. And we should look out for our friends and colleagues in every and all ways. So I'll leave you with this. I think you all are the strongest people I've ever met. And I say to you, we are going to dedicate ourselves to know each other for a really long time. Find a colleague that is an even better friend. And I don't mean a sponsor. I don't mean a mentor. I mean a friend. Thank you so much for having me.